This is a recording of this year's Virtual Residency Fair. We'd like to take the time to thank the programs that volunteered their time to present to this year's applicants. This year's PM&R Scholars Virtual Residency Fair is supported by PM&R Recap and Ultrasound Guidance. PM&R Recap is the leading resource for your physiatry board preparation, clinical preparation, audition rotations, and beyond. PM&R Recap offers 35 hours of review videos, hundreds of review questions, and oral board cases to help you become the best physiatrist that you can be. Head to pmnrrecap.com to learn more. Ultrasound Guidance is the innovative new online ultrasound learning platform that gives you instant access to expert instruction. With rapid scans and complete scans of every joint and peripheral nerve, Ultrasound Guidance is the perfect way to jumpstart your MSK ultrasound learning. Visit ultrasoundguidance.com to learn more.
So we're the Wright Center, Physical Medicine and Rehab Residency Program. My name is Sunil. I'm a PGY2 at the Wright Center. I'm accompanied by our program director, Dr. Kenneth Gentileza, for this presentation. So with that, let's kind of get started. And we're going to try and get through this a little quick so we can, if you guys have any questions or anything, we can get to those. So we'll try and get through the presentation pretty fast. Okay. So a little bit of a program overview. We're fully accredited by the ACGME. We actually had our ACGME site visit back in spring 2024. This site visit went very well, and we were informed in August 2024 that we received full accreditation from the ACGME. So we're happy about that. We're a 4-year categorical program with an integrated PGY 1 year, and we take 5 residents per class per year. So we're a new residency program. Our first class was in 2022-2023, and this is our current PGY3 class. Currently, we have 15 residents total across PGY1 through PGY3 classes. And then next year, we're going to have our first full program with 20 residents across PGY1 through PGY4, and that'll be how it's going from then on forward. So some highlights of our program. So our primary training locations are at Allied Rehabilitation Services and at Northeastern Rehabilitation Associates. So Allied Rehabilitation Services, this is a nonprofit here in Northeast Pennsylvania. They have multiple inpatient rehab hospitals, skilled nursing facilities, long-term acute care hospitals, and outpatient facilities as well. This is where we do the majority of our inpatient rotations for rehab rotations. Northeast Rehab Associates, this is a private PM&R practice. This oversees our residency program, and this is where we do the majority of our outpatient rotations. Northeast Rehab Associates is also one of the largest private PM&R practices in the state, which also might mean it's probably one of the largest in the country. And this was started by our program director, Dr. Kenneth Gentileza, back in 1989. Our sponsoring institution is the Wright Center, and they also have some other residency programs as well in internal medicine, family medicine, as well as some fellowship programs in cardiology, GI, and geriatrics. We do some of our clinic rotations at the Wright Center in rheumatology and pediatrics during our PGY 1 year. We do a pediatric rehabilitation rotations. Those are going to be through the Children's Hospital of Philadelphia. This just started this year, and our first class of PGY3s is going to be going there for the first time next week in September 23rd. We're really excited about this partnership, and we know that there's few places that can offer better training in pediatric rehabilitation than CHOP can. We also have an in-house NAS-accredited interventional spine fellowship that is offered through Northeast Rehab Associates. And our program director, Dr. Gentileza, we just call him Dr. G, so I'll probably refer to him as Dr. G from now on. He's currently working on starting a sports medicine fellowship for our program and getting sports medicine rotations for our residents. So stay tuned for that. So a little bit on our program leadership. On the top right, that's Dr. Gentileza, our program director. He started this program a couple years ago, and we'll be spending time with him every week during didactics, as well as when you do your consult rotations and kind of learn about how people get admitted into the inpatient rehab facility. He's the one who founded Northeast Rehab Associates back in 1989. And he kind of shows us the business side of PM&R as well as the business side of running an outpatient PM&R practice. On the bottom right is Dr. Michael Wolk. He's one of our associate program directors, and he's a medical director of the Allied Inpatient Rehabilitation Hospital in Scranton, Pennsylvania. He runs the stroke and spinal cord injury services at Allied Scranton, and he also gives us education and exposure on what it's like to be a medical director of an inpatient rehab facility. On the bottom left is Dr. Klein. He's our other associate program director, and he runs the brain injury unit down in Wilkes-Barre. And this is at Allied John Hines. Dr. Bednarz is up there on the top left. He's a really significant member of our program leadership. He runs the general medical service at Allied Scranton. And we also do rotations with them for EMG and outpatient rehab at Northeast Rehab Associates. He runs a EMG workshop for us every year, and he also gives us a lot of exposure and education on medical legal work and PM&R. Dr. Connor runs our pain fellowship program along with Dr. Naftalin. We rotate with Dr. Connor for our pain rotations, and he also runs workshops for the residents in physical exam skills as well as a spine workshop. In the bottom middle is Dr. Weinberger, and this is our internal medicine physician. He's in charge of the PGY1 curriculum, and he runs the inpatient internal medicine consult service at Allied Inpatient Hospital in Scranton. We spend a lot of time with him during our PGY1 year for our IM consult rotations, and he's a really great internal medicine teacher, one of the best I've ever had. And you learn a lot of the internal medicine side of some of the common rehab issues that we see in the rehab hospital, and kind of how you take care and how you manage those internal medicine problems that happen. So with that, let's move on to our primary training location. So this is our first training site. This is our Allied Inpatient Rehab Hospital in Scranton. It's a 50-bed inpatient rehab unit. And here you'll do your stroke rehab months and your spinal cord injury rehab months with Dr. Wolk. When you're with Dr. Wolk too, you'll get a little bit of education on the medical director side of rehab and kind of what it's like to run a facility from that medical director side. He'll give you a lot of exposure into that, which is really unique and something that we really pride ourselves on in our program. We also do months of general medical rehab and orthopedic rehab with Dr. Bednarz here. And then you spend a lot of your PGY1 here doing internal medicine consults with Dr. Weinberger here. Our next site is the Allied John Hines Rehabilitation Institute down in Wilkes-Barre, Pennsylvania. So here is where you'll do brain injury rehab. It's a 47-bed unit, and you'll do your brain injury rehab months here with Dr. Klein. You also get to see some general medical rehab here too. So it's a nice other location that we do this at, and it's about 20 minutes away from our primary site in Scranton. Okay. So Northeast Rehab Associates, this is our outpatient facility. So there's offices all across Northeast Pennsylvania, but the primary ones that we go to are in Scranton and Wilkes-Barre. But you can travel to these other locations if you're interested in any specific outpatient field and want to go get more exposure into something. We can send you to those other sites too to get more exposure. So you'll get exposure to private practice, general PM&R with outpatient stroke, TBI, SEI, and MSK clinics. There's disability exams that get done here, independent medical exams, and you'll get exposure to all of that in our Scranton office. You can also do your interventional pain rotations here in our Scranton office with Dr. Connor, Dr. Naftalin, Dr. Zhang. You'll do EMGs here as well with Dr. Bednarz. And we also have ultrasound rotations and ultrasound guided injections here with Dr. Williams in Scranton. You also get a lot of exposure to medical legal work and how medical legal work is in PM&R with Dr. Bednarz, Dr. Wolk, and other attendings at our Scranton location. So that's something that's pretty unique about our program, is you get exposure to that other side and the business side of PM&R with all of these rotations. So here's kind of a sample rotation curriculum. Really, I kind of already talked about a lot of this, but I just kind of want to show that, we get a lot of our inpatient rotations during our PGY2 year, just like a lot of other programs do. And then you start to transition into doing more outpatient as PGY3 and PGY4 years. And then our PGY1 year is integrated into our schedule with a lot of internal medicine consult months at our Allied Rehab Hospital in Scranton. So with that, let's move on to call. This is a question that I've seen in a lot of presentations focus on. So right now, our call schedule, PGY2s are on home call every weekday evening until 9 p.m. on Monday through Thursday when you're on an inpatient rehab rotation. And really, you're just answering calls for the patients that you're seeing. After 9 p.m., the attendings take over, and on the weekends as well, the attendings are the ones who take calls for all those patients. There's no overnight call in the hospital. And then we currently have a weekend call. PGY3s are the ones that are doing this currently, but we may expand this to PGY2s being involved. We're still kind of working on that. So that's a little bit up in the air, but right now there is weekend call, and PGY3s are the only people that are doing this, no PGY2s. So really it's just weekday call for PGY2s. And then right now there's PGY3 weekend call, but that may change going forward. Okay, so didactics. So currently our didactics are on Friday afternoons from 1 to 5 p.m. This is a mix of attending and resident lectures, as well as lectures from our therapy staff, internal medicine attendings, and pharmacy on high yield rehab topics. This is protected time, so all residents can participate. And then we have like PAs, and the attendings are going to be covering those services during our didactics. And then we're currently in the process of revamping our didactics to be a little bit more interactive and hands-on by adding more case discussions, journal clubs, board review question blocks. And then we're also adding some more workshops in EMG, ultrasound, and pain into our didactic curriculum. This is kind of based off some resident feedback that we had last year. And that's kind of a thing about our program is that our leadership really takes resident feedback into their decision making, and they really change things based off what we tell them. So that's a really nice thing that we have. Every year, we give yearly grand rounds, every PGY2, PGY3, and PGY4. And you'll do this on like some rehab topic at Allied Hospital in Scranton. And you'll be giving this grand rounds to all the therapy staff and all the attendings at Allied. We're also setting up a cadaver lab with the University of Scranton. And that's going to be where our anatomy curriculum will be based through. And then in terms of research, our attendings at Northeast Rehab associates always have case reports that they inform us about, and we can write those up for national conferences. A lot of us just submitted case reports for the AAP conference in Arizona in February. So we're just waiting to hear back on acceptances from those, and we're all excited about that. All right, let's move on to some benefits that our program offers. So we get paid memberships to AAPM&R. You get a $2,000 educational stipend that you can use throughout your rehab or throughout your residency. We can use this for board exams, for textbooks. If you want to get some online review series that you like, you can use that money towards that too. A lot of us use it for taking step 3 and for taking Comlex 3 and for those board fees associated with it. So it was nice to have this available. And then a bunch of us also bought PM&R Recap, which is like the online video series. And we used some of this money to do that. We also get a $2,000 yearly food stipend through Allied Services. And then we can use this anywhere that we want. We also have 31 total PTO days, and this includes your vacation days, your sick days, and your holidays all kind of together. So you have 31 days spread throughout for all that. Then you also get 5 additional CME days for PGY2s and above. This can be used to attend national conferences, and you can also use these days for other PM&R educational opportunities. Like if there's a workshop or something that's hosted in Philadelphia, you could use a CME day to go attend that as well. So what's living in Scranton like? So honestly, I'm from Louisiana originally, so it's this moving up to Pennsylvania is very different for me. I think the best thing that we have is a very low cost of living. A lot of us live in super nice modern apartments with these amazing showers that have these jet things in them. And then all of us pay less than $1,500 a month for these apartments. I'm in my apartment right now, and it's amazing. I'll tell you, I lived in New Orleans, and it was like 2 grand a month for some really horrible living conditions. Scranton's location is also amazing. You're only a 2 hour drive away from New York City and Philadelphia, and you're within 3 to 4 hours of a drive to Baltimore, DC, Boston. It's really easy to do day trips anywhere on the weekend to go places. And I've been going up and down the East Coast since I've been here. Um, like I said, I'm from New Orleans originally, so I'm a really big foodie and into restaurants. And the Italian food here is absurdly good, truly one of a kind. Like most of my top Italian restaurants are located in this area of Northeast Pennsylvania. There's amazing pasta dishes, amazing pizza. It's just insane how good the Italian food is here. Um, a lot of our residents, they like to ski in the winter at Montage Mountain, which is only a 10-minute drive from downtown Scranton. There's lots of hiking available, beautiful parks, and a lot of dog parks too, actually. So bring your dog because it's very dog friendly here. We have minor league teams. We have the Yankees AAA affiliate with the Rail Riders. Really awesome looking stadium and fun games to attend. And then the Pittsburgh Penguins, their minor league team, the Scranton Wilkes-Barre Penguins, is here too, and I go to their games all the time. Costco is about 45 minutes away in Allentown, and then there's a Trader Joe's that's about an hour away in New Jersey. The Scranton Airport's pretty decent. You're able to find late flights usually after 5 p.m., so you can go after work. Newark and Philadelphia airports are within a 2 hour drive, and these have access to flights all across the country and internationally. So our airplane situation, our airport situation is pretty decent here.
About
So
3 minutes left.
here's a picture of Scranton, of downtown Scranton. I kind of want to show this just because I know a lot of people's views of Scranton are based off The Office, and I think The Office kind of made Scranton look a little bleak, but it really is beautiful out here. Fall in this area is awesome, and I'm really looking forward to it. And we get great views of the mountains and the valley from our work sites at Allied. We have these awesome windows that are in our offices, and I'm often staring out of them. Here's a map of where Scranton's located in relation to the rest of the East Coast. As you can see, you can get pretty much anywhere on the East Coast within a 3 to 4 hour drive, and New York and Philly are within 2 hours. Um, so community involvement. This is our big program each summer. It's the Nittany Lions Summer Impact Program. We have Penn State football players come out to Scranton each summer and teach children from underserved backgrounds and children with special needs teamwork skills and camaraderie skills through football activities and these drills. These pictures kind of show some of the football players that came out this year. They're signing some football, signing some t-shirts. It's a lot of fun every year. And Dr. G is a huge Penn State fan, and he's the one who gets this set up for us. In terms of resident wellness, I kind of just want to throw in some pictures. Here are some pictures of us celebrating birthdays inside of our didactics. Here's a picture of us going out to dinner. We do ultimate frisbee every Tuesday night. I'm trying to set up a basketball league. So hopefully I can get that set up on one of these nights. A lot of people go skiing, as I kind of mentioned earlier. We host game nights at each other's houses, go to day trips together. Like I said, Dr. G is a huge Penn State fan. He has season tickets, and he'll take the residents out to Penn State games to go tailgating and go to the games. I think we're going to go on the 28th of September. So that'll be a lot of fun. And we also have a really competitive in-house fantasy football league with a lot of the residents and attending. So that's a lot of fun too. So with that, I kind of want to open up the floor up to some questions. Here's my contact information, and please feel free to shoot me with a call or a text if you have any questions. Email me with any questions. If I can't answer your question, I'll make sure that I get to someone who can, and I'll reply back to you. Okay. And
1 minute left.
okay. Well, let's see if there's any questions in the chat. And if there's not, just remember you can always reach out to me, and I'll be able to. Okay, it doesn't look like I see anything on the chat for any questions. But if you guys do have any questions, you guys can reach out to me on this phone number or this email. And yeah, thank you guys again for letting us be here.